All right, good afternoon, everyone. How's everyone doing today?
Great.
Awesome. Thank you, ladies, so much for joining us for our first DEI Speaker Seminar Series of 2022. It is titled Implicit Bias in Healthcare that focuses on endometriosis. My name is Janika Reed, and I am one of the co-chairs of the Peace Task Force Committee. Peace stands for Pharmacy for Equity, Acceptance, Compassion, and Excellence. I am also a board member for Endometriosis Association as the Director of Special Projects with Color Outreach. Dr. Ramanathan, would you like to introduce yourself?
Yes, hi, my name is Meenakshi Ramanathan. I'm an infectious diseases clinical pharmacist, and I am the co-chair with Janika on the Peace Committee. So everybody, welcome.
Awesome. And I don't know what happened to my views. My spotlighting is gone. Let's see. All right, let me try to get my speaker spotlighted, but all right. So today during Endometriosis Awareness Month, we will have 3 endo warriors share their personal journey of living with endometriosis. Simply put, endometriosis is a painful hormonal and immune disease in which tissue that normally lies inside the uterus starts to grow outside the uterus and it starts attaching to outside organs. Millions of women and young girls suffer from endometriosis. This topic is very personal for me, as I was diagnosed with endometriosis in 2016. I was initially diagnosed with uterine fibroids, which I had them removed. And then I was diagnosed with endometriosis in 2016, but because I was misdiagnosed with chronic constipations, I wasn't diagnosed until almost a year later. And then this marked the beginning of a long journey in which I had major surgeries that changed my life, and I still struggle with today, especially with kidney and bladder issues. With that being said, please note our panelists nor myself we are not healthcare professionals, and we are not advising of any treatment or treatment plans. Our goal is to hear personal experiences of women living with endometriosis to continue to raise awareness and to discuss the implicit and also racial disparities in healthcare. So I am trying my best to get our speakers spotlighted. Give me 1 second. Dr. Ramanathan, there we go. All right, are y'all able to see our speakers? Okay, awesome. All right, we will start with our panelists introducing themselves and allow each of them to share their personal journey using the questions that we have from our agenda today. We will then go into any questions from the chat room and also the registration form if you filled out any questions there, if we have time from the end of the event today. And let's see. So our first question, we're going to move into the introduction of our speakers. So Ms. Foster, we will start with you since I see you first on my screen. You can introduce yourself. You can provide your name, where you're from, and also your occupation.
Hello, everyone. My name is Nicole Foster. I live in the Keller area, the Dallas-Fort Worth Metroplex. And I am a photographer, and I also work in sales. And my journey started back in 2006.
Awesome.
And any more you want me to add to that?
Name, occupation, and okay, I think you're good. Ms. Peters, would you like to introduce yourself?
Absolutely. Hi, good afternoon, everyone. My name is Lindsay Peters. I currently live in the DC area and I work in communications, and I was officially diagnosed with endometriosis in 2017.
Thank you. Ms. Cornegay.
Hello, everyone. My name is Lauren Renee Cornegay. I am located in Oxon Hill, Maryland, and I am the founder and executive director of Enzo Black Incorporated.
Awesome. Thank you, ladies. And again, thank you so much for sharing your journey today. So we were going to dip into the diagnostic journey of when you first dealt with endometriosis. If you don't mind telling me when and how you were diagnosed, how many providers did you see before diagnosis? Was there a delay in your actual diagnosis? So I think Dr. Ramanathan, you put this in the chat for them to see as well. Awesome. Well, I don't see the second
No,
one.
I'm working on it.
Okay. It's kind of slow when we get into, so y'all get spurred with us a little bit. We're not Zoom savvy. So I'll just walk you through the first questions. We're going to start with Nicole again. So when and how were you diagnosed?
So I was diagnosed back in 2006. For several months, I had begun to experience pain, and the doctors found cysts on my ovaries, and the pain intensified over months and months and months. And finally, one particular morning, I was in excruciating pain and called my doctor prior to office hours, and he told me to go straight to the hospital. And they were going to remove the cyst at that time. The cyst, they averaged from 9.9 centimeters to 10.5 centimeters on each side, and got me into surgery, opened me up, started with laparoscopic to try and remove the cyst and was unable to, and decided to go ahead and give me what pretty much is the cesarean cut, and found out that my uterus, my ovaries, my bowel, and my appendix was all fused together. Because they were not prepared for the bile, they immediately closed me up. So a 45-minute surgery turned into a 6-week journey of healing from just that surgery. I moved forward for the next few years until I just couldn't take it, managing pain, taking all kind of painkillers, just whatever it is that I could, manage the pain, taking the depot shot. Also tried the Nuvo ring and all of those things to just try and keep me from having a monthly cycle. And finally in 2011, I just couldn't take it anymore and decided to go ahead and move forward with the hysterectomy. At that point, they complete hysterectomy, removed my uterus, my ovaries, my appendix, and also had to rebuild my cervix. My doctor at the time told me that everything was completely fused together. She could not tell one organ from the other. And now I still experience pain in my back, kind of more so on the left side of my back, oftentimes feeling as if there is a tennis ball just sitting in my back. I've gone to a couple of doctors to see if there's anything that they can do. And they always say, oh, there's nothing, I can't even find anything. I'm not even sure what's wrong. I've been just diagnosed with additional painkillers, which I just don't take. So that's been my journey, and that's where I am today.
Thank you so much, Ms. Foster. Ms. Peters, you mind sharing your journey for diagnostic?
No, not at all. I remember first seeking out help in 2012, and like you, Nicole, they found some cysts, and so that was what we thought was the problem. But a few years later, it becomes hard to go about my daily life because I'm experiencing heavy periods and bloating and backaches and migraines, major depression, mood swings, endobelly. One day I would be 10 pounds higher than I was the next day. So I went to my primary care doctor at that time and asked her to refer me to some type of specialist, gynecological specialist. Well, she didn't want to refer me to anyone because, as she told me, it's all in your head. You're having what is called a normal period. So knowing myself and my body, I knew that wasn't right. So it took me about 6 months of pushing her before she finally referred me to someone who was an OBGYN, but also supposedly had some endometriosis knowledge. And it wasn't until 2016 when I had my first laparoscopic procedure that he did find endometriosis. So that was and then a year later, I had my second lap with a different doctor. summer of 2020, I had a hysterectomy. They kept my left ovary, even though my left ovary was bothering me more than my right ovary. And then after that surgery, there was also a tear in the vaginal cuff wall. So here we are now, 2022, and I'm still having issues. I've probably seen between OBGYNs, natural doctors, holistic doctors, maybe 12 to 13 people before, in my journey. And I can't even tell you the amount of meds or vitamins or herbs that I have been on or tried as well. So it's a journey that continues, and we have to just take it one day at a time, unfortunately.
That is so very true. Thank you, Ms. Peters. Ms. Carnegie, would you like to share?
Yes. So I actually was diagnosed on accident. Honestly, I dealt with pain my entire life, and like Lindsay said, there were people talking about how this was the normal thing. This is normal pain. You're a woman. You're strong. These are things that happen to you, so you just have to bear with it. Coming out of high school, going into college, I attended Morgan State University in Baltimore, Maryland, and just so happened that one month my cycle came and it went away, and then it came right back probably about 2 or 3 days right after that. And that was the first indication that something was wrong. I went to the ER. The ER doctor told me to go to an OBGYN. She recommended me to go see. Went to her. And it was a private practice, family-owned business. Went there, and she just started asking me all of these questions, like, well, describe your period for me. And I described that my left leg were hurt before my period, my right knee were hurt after my period. I had sharp pains in my back, sharp pains in my chest. I had abdomen pain, shortness of breath, all of these symptoms that I was sharing with her. And she said, none of that is normal. And I was like, what? Like, that's not what we've been taught. And she said, I think that you may have endometriosis. Let's do a pelvic exam. She did the pelvic exam, and she discovered that I had a reverted uterus. And with that, she said, let's go ahead and schedule an appointment for you to do a surgery, the laparoscopic surgery. I ended up being diagnosed the following year on March 18th, 2011. Even after being diagnosed then, I did not take it very serious. I didn't understand the severity of endometriosis. I barely knew how to spell it or say it. So that was something that was very difficult for me. And then not recognizing that this would be a lifelong journey was something that I was clearly not aware of up until August of that same year, when I ended up going back into the hospital because I had a cyst rupture, leaving 2 gallons of blood in my abdomen. And with that, that is when I began to really understand what endometriosis was, and understand that this diagnosis would be really a long-term journey for me.
Thank you, ladies, so much. And yes, I do relate and can relate to this long journey of definitely being diagnosed. I wasn't diagnosed until 2016, but going through different specialists and different doctors trying to determine, okay, what is it? And then not telling me they don't know, or they couldn't understand why I was having that much pain. But to finally to get a diagnosis, you feel kind of free, but at the same time, it's going to be an even longer journey once you get diagnosed. So I do understand, and I can't relate. So let's move on to the next question in regards to infertility. For endometriosis, it increases the risk of having difficulty with becoming pregnant, and also infertility. Did you experience any type of infertility during your journey? And I guess I'll start with you, Nicole, first.
Well, had I known that that was my issue, then I definitely could say yes. I've only given birth to one child, but have experienced 3 miscarriages. One of the things that I recall prior to 2006 was that I would pass very heavy blood clots, to the point that I could feel them as they were passing. And not knowing, that was associated with the endometriosis. And one of my miscarriages, I actually, it happened just out of, we were traveling and we pulled over and I was not in any pain at that time, and passed it right as we stopped at a rest stop to go to the restroom. But aside from that, I was able to give birth only once and have not been able to do so since then. And of course, now I certainly can't.
Whew, so sorry, Ms. Foster. Ms. Peters, would you like to add into that?
Yeah, I don't know because the disease made the decision for me that I cannot have children. So I don't know if it caused any infertility. I know what it caused is for me to make one of the biggest decisions of my life and pursue a hysterectomy. So I can't have children now, but that's because I don't have the parts because endometriosis took that experience from me.
Thank you, Ms. Peters. Ms. Carnegie?
Yes, and I apologize. I somehow turned my camera off.
Oh, no, you're fine.
For me, at this point in my life, I actually am not at that place. However, I've recently learned that I can speak with my OBGYN about, infertility and talking to them about seeing the levels of possibly having a child in the future. Again, I don't know because I haven't tried. But now that I know that I can ask these questions to my OBGYN, which I think is something that is not known very often, that you can ask your levels. And that is actually a free test that can be done for you. Now that I know that, I can communicate and hopefully learn more information about my possibility of having children in the future.
Awesome. Thank you, ladies, so much. And for me, I think the decision was already pretty much made because I've already had my kids. I had my kids very young. So me and my husband did decide later on that we weren't going to have any more. Of course, he wanted a girl, but I was like, no, we're not about to do that. So when I found out that I had endometriosis, I was asked, do you plan on having any more children? And I told her, no. Me and my husband decided that two was enough. So we were done. And so she did say that because I was at a stage 3 with my endometriosis, which was severe, that I had a greater chance of not having children. So my only option was to have a full hysterectomy. So that's what I did in 2016. All right, let's move on to the treatment journey. And the question is what options were you given from your healthcare providers? And do you feel healthcare providers listen to you? Let's just start with those couple of questions first. And Ms. Foster, of course, I'm coming to you first.
So what options was I given? So it started with, we're going to try the Nuvo ring. And, that was back in 2016 to see if we can control your menstrual cycle so that, the flow isn't so heavy and you're not passing those blood clots. Well, of course, my uterus was, by this time, was probably already deformed that the Nuvo ring would not remain in. So it would slide out. So then we moved to the depot shot. Well, the depot shot caused me to gain a tremendous amount of weight. I used to say that I looked like I was a linebacker for the Dallas Cowboys. That's how much weight I had gained from it. And then when finally the pain was just so unbearable, just months before having my surgery, my doctor tried to insert the Mirena, and I never saw what the Mirena was, but she told me that it was about the size of a pencil. But when they tried to insert just the tool, I was in so much pain. I was holding the nurse's hand and I squeezed her hand so hard that I left my fingerprints in her hand because I was in that much pain. At that point, she told me that my uterus was basically in a seating position, and the cyst that was on my ovaries that had pushed it's down so far that she could not insert the tool. So at that point is when we decided that it was time for me to move forward with making a decision if I wanted to have the hysterectomy. And I said, I don't want to be in this pain. So the decision has been made. And are you sure you don't want to have any more children? I can't have any more children if I got to suffer this pain. So we moved forward and moved forward with the complete hysterectomy.
Wow, Ms. Peters?
As you were talking, Nicole, I was nodding my head because the same thing happened with me with the marina. Not only were there issues going in, but it didn't do anything for me except make me even, it kind of exacerbated the endo symptoms. So I asked for them to take it out, and it hurt even worse coming out. But, you know, like you, I've done the marina. Oh, one doctor told me, here's something that we can do. Go out there, find someone and get pregnant. So that was another one. That was another one was, let's try Alyssa, which I said no, because I'd already done Zoladex and Lupron, and Zoladex treats breast and prostate cancer. And here you want to put me on these injections. And I did do the Zoladex injections, and I got so sick mentally and physically. I remember having a breakdown in one of my doctor's office and asked for help, and said, this can't be right. This can't be the right choice of medication. And instead of listening to me, he wrote me a prescription for water pills for bloat and to see a psychiatrist because I was so hysterical, as he would have said. So they also tried to do Lupron for me. This was another doctor. I think I did one injection of that, and then that was it. So between all of that and doing natural stuff or working with a holistic doctor, just trying to maintain and do my best to keep going, but none of the treatments work, which is why after I had one lap and then I had another lap, one was ablation, one was excision, and then the other one was the hysterectomy minus the left ovary, which I said earlier was still bothering me and will probably be coming out soon.
Thank you. Thank you both, ladies. Ms. Carnegie?
Yes. So what options? To be honest, it was just birth control. And I did do that. She recommended that I get on Loestrin, I believe. And I know I didn't like the way control made me feel, but I was on Loestrin, and that was because of the cysts, and that was supposed to maintain the size of the cyst, which we know did not necessarily work because it ruptured. I do not think that all medical professionals listen. I do have some that have listened in the past, and I do have some that have just, gaslit, just totally disregarded or ignored what I've said. Two instances in particular stick out to me. I know that for me, that with having endometriosis, sometimes there's a chance of having a reoccurrence of UTIs a lot. And because I know that about myself, I'm able to communicate that. And I went to a OBGYN after I relocated back from South Carolina to this area, Maryland. And I thought that I was doing a good thing by looking for a doctor. I did the reading on them. They had good ratings. They had good reviews. I went to the doctor. I told her my situation, told her that I possibly had a UTI. I have endometriosis. This is not the first time this has happened. And she totally disregarded me, completely disregarded me, said that I probably had an STI, that I probably have pelvic inflammatory disease, that I need to do the pelvic exam. And I was like, you're not listening to me. I'm telling you, because this is my personal experience, and this is my body, so I know. And she was like, no, this is what we're going to do. And I'm not really a confrontational person. I did go to the doctor, so let me try to listen and be respectful, I guess. And I did, what she asked me to do. Sure enough, called me back after we did the pelvic exam, told me that I didn't have an STI, which I already knew, and then told me she didn't know what was wrong. And then that was the end of the conversation. No further guidance, no further recommendations to see anybody. So I ended up doing this process all over again. Ended up going to a different doctor's office, another private practice. And the nurse was like, well, why wouldn't she just do a urine sample? And I was like, you asking me? You gotta ask the lady that wasn't listening to me. I don't know. I'm with you. She was like, I just don't understand. I was like, it was a lot. And I felt bad because this was something that I knew about, just like Lindsay said, how the doctor didn't listen to her and told her that she needed to go see a therapist. Of course, we all need to see therapists. I don't have a problem with that. But when I'm telling you that something is wrong, I think that it's imperative that you listen to my perspective because I'm the person with the lived experience. And you can't tell me what I'm feeling because you are not me. So that takes away a lot, and that makes people feel very discouraged going to doctors' offices, explaining their story over and over and over again and not being listened to. And for me, some of the treatments that I think work best for me, it's honestly a variety of different things that I tried different times. Of course, heating pads, weighted blankets, CBD ointment, lotion, CBD drops, also, using supplements, paying attention to vitamins that I'm, looking at minerals. Vitamin D is really important for a lot of us to intake to make sure that we're taking care of ourselves. Magnesium has been very helpful to me in the past as well. Also monitoring the foods that I'm doing and taking. For me personally, depending on when, which I think is also really weird, for the first part of 2020, I really love Chick-fil-A. So I have the problem with going back and forth to Chick-fil-A getting milkshakes. And what I recognized after 3 months of doing that every time I would get a milkshake right before my cycle, it would be the week before my cycle came, I would get really sick, really nauseous. I would throw up. I would have headaches, migraines, all of those problems. And I just couldn't pinpoint what was the issue until I realized after this third time that it was the dairy intake. So just being mindful of the intake of red meat, the dairy, the soy products, because it has estrogen in it. Sometimes we think that being veganism is a cure-all thing. And I'm not going to tell you it may not work for you in particular, but for me, that doesn't work. So we have to just be mindful of what we're ingesting and what we're doing, and just pay attention to those things. So those are some of the things for me when it comes to treatments without medication that I am looking into doing. We can't hear you.
Okay,
You're on
there we
mute.
go. I was muted. See, this is me and Zoom, boo-boo. Okay, so thank you, ladies, for sharing that. I think for me, nothing that really worked for me, because my only option was to have a full hysterectomy. I was told because my endometriosis was so severe and so beneath my pelvic wall, my only option was to have the surgery to have my uterus removed, because I've already had a partial hysterectomy from my uterine fibroids. So I wasn't given any other options. That was just pretty much it. And then, of course, I've noticed my eating has changed. I used to eat cereal for breakfast, lunch, dinner. Now I don't even like milk. I can't even drink milk like that. I drink some almond milk from time to time, but that doesn't even sit well with my stomach at times. And then red meat, I can't eat it. I can't eat ground beef. Like I used to tear up some burgers, but I can't even do that anymore. I can't eat burgers. I try to eat chicken more often, but chicken sometimes I'm starting to burn out on it because I eat it so much. But Chick-fil-A, like Chick-fil-A is my thing, but but the milkshakes, no. But the nuggets and the fries, I try to eat, but can't do too much. I can't do fried food anymore. I can't do too much of any of that. So yes, my eating has changed. And of course, the only option for me was the hysterectomy. So I guess we can answer a few more questions. We can answer some questions before we move on, since we do have a little bit of time before we move on to the next topic. Mina, did you want to go over the questions?
I can go over them.
Oh yeah, Raleigh can go over them. That's fine. Go ahead.
So this question was posed in the chat, but what questions should we as women be asking our medical providers if we even have a slight concern that endometriosis may be the cause of our fertility issues?
Would anyone like to answer that? Ms. Foster, would you like to answer that?
Well, first of all, I think one of the main questions that before you entertain the treatment is to one, consider what your options are, or your choice is going to be when it comes to birthing children, because that will definitely be a part of the concern. Anyone that goes through this process, because that's probably going to be, I won't say probably, but the option is they're going to ask you, are you going to want to have children if you do have endometriosis? So once, asking them to, not just looking at the cervix, your ovaries, because I think all of us kind of experience cysts on our ovaries, and those are kind of the initial signs. But making sure that they're doing a complete pelvic exam, making sure that you are sharing all of the pains that you're experiencing. One of the things that I feel like I failed at is that I did not, explain how bad my cycles were. I typically would only have a 3-day cycle period. However, the pain that I experienced was excruciating. I could truly feel blood clots as they were be passing. So basically, make sure that you're being honest with your pain, and what's happening during your cycle. Before the cycle, just as I can't pronounce her name, Miss Corgay, I'm sorry, was just stating. Your foods. When I've noticed recently that when I do eat more oily foods, that the pain in my back is more severe. As long as I start watching my diet and eating more raw food and all of that, then that pain begins to diminish. So making sure that you're, first of all, watching your body. Our body will tell us a lot of things, and we have to share that with our doctor, because they're not going to just perform an exam without knowing exactly what you're experiencing. Some doctors definitely are going to just kind of blow you off, as the most recent doctor that I visited. So now I'm in the hunt for another doctor. But making sure, first of all, you're honest with your doctor and giving all of the information, detail, all of the pains that you're experiencing, with your spouse, if you're sexually active, making sure you're aware of what's going on so that you can provide the information to your doctor, and they can then move forward with, treatment options. One of the things that was offered to me was testosterone. I don't want to take no testosterone. That I threw that off the table right off the bat. But making sure that you're being honest, and that's number one, is sharing what's going on with your body, what you notice, the weight gain, during your cycles, the pre-cycles, you start experiencing pain before your cycle actually begins. So you'll say, oh, my cycle is coming up because of this, or because of that. So making sure that you're detailing and documenting everything that you're experiencing so that you can share with your doctor. And then once you begin to have that conversation with your doctor, then the questions and answers can really flow. Because there are some questions that I may go to and say, hey, this is what's going on with me. Could I have endometriosis? But it may not be the same thing for you. So my number one key is going to be, to detail what you're experiencing, your daily life experiences, and especially around, the start of your cycle.
Awesome. Thank you so much, Ms. Foster. Did anyone have anything else to add to that?
We haven't, sorry.
I'm sorry, I just wanted to circle back. I did mention a test to gauge your fertility earlier, and just want to let everyone know it's FSH levels and AMH levels that you can speak to your gynecologist about. Again, this was something that I recently learned. Even though I'm in the space of women's reproductive health, I still didn't know that. And this is something that I don't think OBGYNs actually talk about very often. So it's FSH levels and AMH. It's a lot of acronyms, I know. So I just wanted to share that so that everybody could be aware of it.
Awesome. Thank you.
We had an additional question in the chat, and I think Ms. Foster kind of answered it a little bit, but Ms. Foster and Ms. Peters both mentioned having a cyst during their journey. Can cysts be an indicator for endometriosis?
I'll start off with that. I think it definitely can be a sign that, there is more going on, especially for me. I chronically had cysts on my ovaries. Every single month I was going to the doctor, and you know, the size of the cysts would fluctuate. But I think, you know, definitely if it's a constant, you know, that is definitely a key that I feel like you should, you know, begin to question and ask them to, you know, pay attention and look into more of what's going on with you, as far as I'm getting some feedback. As far as, you know, what's going on with your body. The other thing in regards to the cyst is, you know, the initial for me was, oh, it perhaps is ruptured. Well, it hadn't ruptured. You know, at this point in time, you know, I was at stage 4 endometriosis when I found out that I had endometriosis, you know, but it was immediately, let's, you know, go in and remove the cyst without even, you know, let's do another exam and see what else is going on with you. So I do feel like that is a red flag, that you should say, hey, there's more going on with my body than what you all are saying, or you all thinking. Is there a specialist that you can refer me to? You know, are there other exams that, you know, can be done? You know, one of the things that I was told is that I'll never get rid of endometriosis. It's always going to be a part of me because of how the scar tissue can spread throughout your body. So, you know, now I believe that I didn't in the beginning, but I do believe it now.
Awesome. Ms. Peters, did you want to add anything to that?
No, I completely agree with Ms. Foster, because same thing with me. I would have my cyst, and then when I would have excruciating pain, the same thing, they would say, oh, it must have ruptured, you know, and I'm like, this can't keep happening all the time. So, you know, definitely if there are cysts, then it's definitely something to look more seriously into. I don't know if that's, you know, all out, you have endometriosis, but it's definitely worth going down a path of, is there more to it than cysts?
Thank you. And just to add on, just know that every woman's body is different. So if you feel a concern for your body, please seek medical attention, because every woman's body is not going to be the same. Even the pain is not going to be the same. Do we have another question we want to go to before we move on?
Yes, we do. So why do you ladies feel that there's still much confusion, even amongst medical professionals, when it comes to diagnosing endometriosis?
Ooh.
There's this thing, I'm sure we can all answer this, I'm just going to throw this out there, because there are not a lot of medical professionals out there properly trained on endometriosis. Endometriosis, even though it exists in 1 in 9 females or 1 in 10 females, that there's still not enough training, there's not enough education, there's not enough skilled professionals that know how to do the proper surgeries. So it comes down to education and awareness and learning, and that's something that I know all of us deal with all the time, is because it's so hard to find someone in the medical field who knows endometriosis. Even living in the DC area, I have to travel outside the DC area to see somebody who is a specialist on it. So there's so much confusion because it's still so unknown, which is very, very shocking. We don't know what the cause of it. That hasn't been diagnosed yet. You know, it can be hereditary. I know no one in my family has had it. I've asked. So there's just so many unknowns and not enough research done to why people are so confused. And, you know, if they don't know about it, it's hard to find materials on it, or it's hard to find people to listen to you as well. So it's an all around struggle in so many areas.
And I'd add to that, you know, we as women, we carry so much. And a lot of times we forget to speak up for our own selves. You know, we will walk around in pain because we got to take care of this and we have to take care of that. But your body is your body, and you only have one of those. So making sure that you're going to the doctor and you're speaking up and you're sharing what's going on with your body, because the only way that it can get better is if you tell somebody. And if you're not going to share it, then the research will not be done if we don't have more women that are saying, hey, we have a problem and somebody needs to fix it.
I'm going to be very honest when I say this. The truth of the matter is, it's because it doesn't affect men as much as it affects women. And if it did, we would have more answers. We genuinely would. And I think that's why it's so important for us to raise awareness, but also to make sure, like she said, to share. We have to share. And sometimes we think we're oversharing. No, you're not oversharing when you're going to the doctor and you're explaining every single thing that's happening to you. Sometimes it may be difficult to really pinpoint a symptom. If you have a migraine, you may not even understand that that may be connected to endometriosis, but you have to start tracking your information. The more information you track, the more information you take to your OBGYN or any doctor for that matter will be more helpful than harmful, if anything. And if that doctor is not listening to you, I think it's more important to say, okay, goodbye. I'm going to talk to you another time. I'm going to go see another doctor, because at the end of the day, you're paying to see somebody that's not listening to you. And it really doesn't make sense. The same energy we put into making sure that our food is correct when we're at the restaurant, or making sure that our car is well serviced when we're at a auto shop, is the same that we need to put in for ourselves. We'll definitely turn that burger right back around and say, hey, this is not what I ordered, immediately, more than we do with our own body. So we have to be proactive. We have to get the documentation out there. The research, the truth of the matter, there is very little research. And then there's also very little research when it comes to people of color. So you have to look at all of the barriers that are in place that actually gets in the way of finding out what endometriosis is, what is caused by endometriosis. We're still trying to understand the real definition of what endometriosis really is. There's confusion about that. There's confusion about what it really affects. Is it endometriosis cells? Is it the lining? Is it this? There's so much confusion about it that we can't really get an understanding of how to treat it if we don't know what it really is, or trying to understand the cause of it if we don't know who it's really affecting. So we have to be honest with ourselves, medical professionals, as well as people that are living with the experience. And we have to be open about what's happening in our bodies, with our bodies, in our communities, things of that nature. Because the truth of the matter is, I believe that I had endometriosis since I was born. It probably just wasn't triggered until I started my cycle. And since then, it's been different things that have been happening, with symptoms starting in 2020 and disappearing in 2021. So we just have to be mindful, document that information, share that information, ask questions. And when your doctor isn't listening, get a new doctor. And it's okay to do that. You won't hurt their feelings. They'll be fine.
Yes, to piggyback off of what you're saying, Lauren, every time I go to the doctor now, I bring a list of questions, and I've had doctors even make, snarky comments like, oh, we're going to sit here all day with these. And I'm like, yeah, we will sit here until you answer all of these questions, because this is my time too. I'm paying you for your time. So I will go in with questions. I even had a doctor once say, you should be appreciative that I took this extra time to talk to you, because we usually give patients, 5 to 10 minutes. And I was like, well, therein lies another problem. So we're not only there's still so many unknowns, but we're rushed in and out of there. So we're just like, it's like rotating in and out, get them, so they don't spend a lot of time with us. So absolutely advocate, write down questions. Who cares if he has to go over? He or she was probably late coming to see you anyway. So get that time back.
So very true, ladies. Documentation is so important. I remember carrying my journal everywhere with me to go to the doctors I was seeing, the specialists, my symptoms, everything. I jotted down in my little black and white paper or journal notebook that I got from the Dollar Tree. So it's important to document everything that your body is going through. And trust me, some of these doctors do not listen. I remember going to a specialist and she didn't even do a exam on me. She just immediately say, oh, you have chronic constipation. No, you didn't even look at my body. You didn't even check for anything. You're just going by symptoms as it's in my chart. Listen to me. And sometimes it takes you to speak up and say something for them to actually listen to you. So it can be frustrating at the same time. Do we have another question before we move on, Mina?
I think the only question that we had that hasn't been answered was, are fibroids connected to endometriosis that you know of?
That I know of, that I was told, no, I don't think it's connected. Well, for me, it wasn't connected to endometriosis. I did have uterine fibroids before being diagnosed with endometriosis, but my endometriosis, I was told, was because of surgical transplantation. Some of the endometrial cells were latched from my incisions onto my uterus, which I then developed endometriosis. But in my opinion, I don't think fibroids is connected to endometriosis. Any of you ladies have an opinion on that?
I do not. I did not experience fibroids. Mine was simply, the cyst on my ovaries constantly, month after month. So I'm not sure if fibroids, is connected in any way. I think that there's one other question, is it hereditary? I have aunts that, have had or has endometriosis. What their journey is, that I'm not sure. I was sharing with a cousin, just kind of, hey, I have endometriosis, and they were like, oh, you do? I do too, and then the conversation began, and so I'm just going to go back to, the statement that I made, share your information with your doctor, share. Don't stop sharing. If that doctor is not helping, move to another doctor, because that's the only way that you can get, the help, the assistance that you need. And they can, do the research. If you really like that doctor, force them to do the research. Hey, no, what you just told me is not working. So let's try something else.
Please and thank you.
Exactly.
So with fibroids, I don't think it's connected. However, I do believe that there are a lot of women who have endometriosis who also have fibroids. The same may be for PCOS. I don't, however, have fibroids or PCOS, but I've come in contact with so many women who either found out they had fibroids first and then found out about endometriosis because of the surgery they had to have for the fibroids. So I think that's very interesting. As far as like people in my family, it is very interesting. Not necessarily everybody in my family, has a disorder. However, we have a lot of people in my direct family and in my extended family that have PCOS, fibroids, endometriosis, or women's reproductive health issues. And I think that is very, very interesting. And I think that there's a genetic marker that may be somehow connected. And I don't think that's the case for everybody, but I think that there is some indication that there may be some genetic marker. And I think there is some research that is getting ready to take place in reference to that. So I hope that brings us closer to a little bit more answers than what we already have right now.
Awesome. Thank you, ladies. I don't think we have any more questions in the chat, so I believe we can move on. The final thoughts is this: how are you today, and what is your life like now living with endometriosis? Ms. Foster?
Well, I'll definitely will say at this point, things are better. I still experience pain. I kind of try and go back and thought, how was I before? And before having my hysterectomy, very emotional, angry, not knowing how to deal with emotions whatsoever. I'd be up one day, down the next day. But now, having the complete hysterectomy, I'm almost emotionless. No, just joking. But definitely, not having to experience the severe pain that I did before. As I stated earlier in the conversation, I do still experience pain, mainly on the left side. And oftentimes while I'm driving, it actually feels like there is a tennis ball that's sitting in my back. And the most recent doctor that I went to, she sent me to have an X-ray. Let's see if you have any muscle tears or anything like that. And I said, I have endometriosis. Okay, well, we're going to see if we can find it on the X-ray. And then she just prescribed me some ibuprofen to deal with the pain, which I just don't take. I just keep moving forward. But it oftentimes feels like there is something literally tearing or pin sticking me. It just kind of depends on, I'm learning, it depends on how I'm sitting and what it is that I'm eating. It used to flare up really bad at night. And so now, I know I kind of sleep a different way so that side of my body doesn't hurt.
Thank you, Ms. Foster. Thank you so much. Ms. Peters?
Dare I say, I want to knock on something. I don't know if this is wood or not, but dare I say that for the first time in maybe, I don't know, 8 years, I feel like I did 8 years ago, because I lost myself in between the journey of what is this, getting diagnosed, and then all the surgical journeys, and then the errors that went wrong in the surgical journeys, and then the medications and the medicines and all this stuff. Like, I lost who I was. I mean, there were days where even getting out of bed to put on makeup, are you kidding me? That was a chore. No, I mean, there were weekends where I would close my blinds and hide on the sofa because I could not function and deal with life. And that was because of the illness. That was because of all the hormones I was on. That was because of the medicines. It all messes with you. And, unfortunately, I did have to have a hysterectomy to get some relief. And I say that unfortunately because that's something that we shouldn't have to make those kinds of decisions, but the disease makes it for us. So after the hysterectomy in the summer of 2020, I definitely, like I said, knock on something, I'm feeling better. However, after the hysterectomy, I mentioned earlier that I had the tear in the vaginal cuff, but it took me almost 8 to 9 months of talking to the surgeon who performed the hysterectomy to get him to believe me that there was something wrong. I've got emails between us. One time I called the ER, their emergency line, and asked if I should go to the hospital, and I was told no, and I'd taken so many pain pills. And finally I had to go see someone else, and immediately they listened to me, like I said, 9 months after the hysterectomy, and of course went on, put me under, and there enough was exactly what I had been advocating for the past 9 months, that there was something wrong at the cuff. And in fact, there was a tear. They had to completely clean it up. They had to cut things out, and they had to refill it back, sew it back up. So since then, so that was almost a year ago, things, like I said, are better, but I will be having to get that left ovary out at some point in time. The one that I told the surgeon was where all the pain was coming from, not the right one, which he took out. But, I've also had to really tweak my diet, alcohol consumption, so I'm a version of who I was before this, but it's more of a tame version. But I'm just happy to be able to put on makeup and talk to you guys today. I mean, that's just a major feat.
Thank you, Ms. Peters. Ms. Cornegay?
Yes, for me, I'm okay. I'm living, managing, and I'm still in the fight. And I think that it has been a process, to be honest, like symptoms pop up every now and then. So, I just have to really adapt to what's happening in that moment. And I really have to just see what the next step is, what the next phase is. Is this going to be something that's going to be detrimental? Will I be able to handle this? I've had situations happen when I lived in South Carolina where, unfortunately, I ended up passing out from a situation. I didn't know if it was endometriosis related or not, but I knew that I needed to get help. I knew that I needed to communicate effectively. And I think that because of endometriosis, I have positioned myself to learn how to advocate for myself better than what I've done in the past. As a child, I was very soft spoken. I was not a person that spoke up about things. If a doctor told me something, I was like, okay, but now I'm more so like, no, I don't believe that. That's not the case for me. This is my situation. This is what's been going on with me. This is how I feel. My feelings are valid. I need a new doctor. And I'm getting to a better place where I'm comfortable with that. And it's not always easy. It's not some thing I just woke up and said, I'm going to do this and be great at it, because there's no guide to any of this. There's no guide of how to maintain your endometriosis, because everybody is so different and we're all still learning. However, I think that this is a process that I've, started to understand, and I understand that endometriosis is not my whole entire life. It is a part of me. It's just one entity of me. I'm a sister, I'm a friend, I'm a founder, executive director. I'm all of these different things. And endometriosis is a small piece of my life that has allowed me to connect with many women, including you all. And it has really just allowed me to, tap into a different part of who I really am. So I'm still grateful for it a little bit, just a little bit, not a lot, but I'm learning, I'm growing, and just learning how to manage this has been definitely a task, but I'm always up for a challenge. And, if I'm not up for a challenge, I don't have a choice at this point, do I? So.
Thank you, ladies. Thank you so much for sharing. And for me, I am going with the flow. I still experience issues with my bladder. My kidney was enlarged for a period of time. I had fluid buildup, so that resulted in me being on antibiotics, but I've been off antibiotics for about 6 months now. So I go back this year in May just to get my bladder checked, make sure everything is still good, my kidney checked, to make sure I'm still on the right track. So I'm getting that monitored every year. And as far as my hormones, they're up and down because I can't get on any hormonal pills or any type of medication like that, because there's a greater chance that endometriosis will reappear, which there is no cure anyway, but it's a chance that it can just reappear for my symptoms. So my mood swings are up and down. I have my husband asking me every day, are you okay today? So that's a good check-in, because he knows my moods. I can be the Hulk 1 minute and then I can bring it back down, especially with the hot flashes. It's no joke. But other than that, I'm doing pretty good and living with endometriosis the best that I can, to just continue to share our journey, continue to share our stories with other people, to continue to spread awareness, trying to get research built up and raising money. It's just a lot just to go into dealing with your everyday life with endometriosis. But thank you, ladies, for sharing that as well. So any other questions in the chat room? Let's check before we move on.
Did have one more.
Okay.
The question was, what would you tell healthcare providers about your experience with living with endometriosis, or what advice would you give them to share with other women?
For me, I wrote a letter to the doctor that misdiagnosed me. I wrote a letter to her advising her to don't ever tell a woman or any person that you do not know what else to do. As a healthcare professional, we're looking for you to seek for answers from you, because we're in pain. We don't know what else to do, but you're supposed to be in this profession to get us assistance and treatment for us to heal and feel better. So I told her, don't ever tell another woman that you don't know what else to do. And if you don't have the answers, seek answers for us. Don't just say, hey, I don't know what else to do. Just send me on my merry way, because you left me in pain, left me alone, left me feeling bad and horrible and depressed. And so that letter from me to her was psychologically healing for me, even though, of course, she gave me a call back within a week later and telling me that she was sorry, and she did mean for me to feel the way that I did, but she didn't know anything about endometriosis. And that's when I sent her a little yellow brochure detailing every information about endometriosis. You can put this in your office. So for the next woman that comes to you with any of these symptoms, you can just pretty much explain to her what endometriosis is and give her the help that she needs if she's seeking it. Any other thoughts, ladies?
Yes, I would wish that healthcare providers would tell women about support groups that they could join or organizations that help. That's something that when I was first in the beginning stages of endometriosis and what is this and where can I go for help and who else has this, I did some research and found that looking for endometriosis organizations, and there aren't a whole lot. I think there are 2 in the United States, maybe. One is the Endometriosis Foundation of America, and one is the Endometriosis Association, which I am now, I know Janika, you're a board member. I'm actually an ambassador for that organization because I wanted to get involved so badly and help others and also be a part of the community amongst others who are going through things with me, like I was. So if healthcare providers could go beyond just the medical terms and also provide women with places to go, support groups to turn to, organizations, and so we don't feel that you're alone, because there are many times that you feel very alone in this journey because it is so identical to each person. It's not the same for everybody, and so you definitely feel like you're probably the only one going through this. But when you're amongst your peers, so to speak, you know that you're not alone. So I would love for healthcare providers to do that. And just like everyone's been saying, I'd love for them to listen to us. I'd love for them to take us seriously. I'd love for them to not write us off and tell us it's all in your head, or do the most ridiculous prognosis and say, go out there and get pregnant. I mean, it's beyond. So the more that, like Lauren was saying earlier, the more that we can talk about it, the more that we can share it. The good thing is, like, sometimes when I'll go see a doctor and he doesn't know, my knowledge of endometriosis, or that I'm a part of these other organizations, so when they start their jibber jabbish with me and try to talk to me like I'm either an idiot or I probably have no idea what he's talking about, then I like to pull out the old card of, oh, well, actually I've done this and I do this and I do this. And then they're like, oh, I actually have to talk to her like a human being. So, I hope women just stay strong, keep their stories going, and advocate for themselves. And hopefully one day healthcare providers will be right there partnering with us.
Can I share those same sentiments? I definitely would like for them to do more research. One of the things that I recall was that I was borderline anemic. And, just another thing that, okay, she's borderline anemic. She's have the cyst on her ovaries. She's in excruciating pain. She's passing blood clots. Let's look further into all of those things. Let's do the research, so that would be definitely something that I wish doctors would really do, to look in women's health and infertility. Seems to be becoming, more and more, more women are experiencing that, as we are progressing. And there has to be a reason. It doesn't just happen, So, definitely, I wish they would take the time to really do the research. And they don't have to, just look at one woman. I was told in the beginning that it was rare for a Black woman to have endometriosis. Okay, so what organs do I have that's different from a Caucasian or Hispanic? What's different? What makes us rare? Just our blood, just a difference in genetics. But was that really research? It's rare because women are not speaking up like we should. And so just being honest and share your story, share what's going on with your body, so that we can find out, find ways to either tolerate this more, deal with it better, instead of having to rush to, a hysterectomy. What are some, can it be changed with your diet? Can, better manage with your diet? But just taking the time to do the research.
I definitely agree with everything that they both said. I would like to add that listening is key, just listening. And I think that a lot of times we become numbers. And we're not numbers. You have to understand your patient. And the truth of the matter is medical professionals are medical professionals. Like, I didn't go to school for a degree. I don't plan on going to school for a degree. So we need each other because I can't do certain things without medical professionals. But it's important to make sure that we have that good relationship. When I was in South Carolina, I had an OBGYN. She had the best personality. She was funny. She made sure that I understood what was going on in doctor terminology, but also broke it down so that I could understand from a patient perspective to make sure that I was comfortable. And she made me feel comfortable, even simple things. I mean, to be honest, OBGYNs, like, you're performing pap smears and pelvic exam. That's a little odd. We're talking and my legs are open. So let's just be honest and be comfortable with each other. Let's not feel awkward about certain things. We're in an uncomfortable setting. So let's go ahead and try to unpack whatever bias you may have, whatever bias I may have as a patient, so that this actual relationship between the patient and the doctor will work effectively. And if we're not working effectively, then we're bumping heads, and there's no point in either one of us because now we're both wasting each other's time. And honestly, you just want to make sure that you are putting yourself in a position to feel comfortable. And you want to make sure that the doctor that you're connected with is a doctor that sees you as their child, as their sister, as their niece. You want them to feel as if they understand how important it is to make sure that you're feeling okay. And if your doctor can't see you as such, you need a new doctor. And if that medical professional is not looking at people like that, they may need to change their profession, honestly. But can't tell no one to change their profession. I'm not qualified for that. That's all I have.
Thank you, ladies, so much. And when people ask me, I always refer them to either Endometriosis Association or Endo Black. So, Ms. Lauren, do you want to expand on your organization?
Well, thank you. Yes, I will. Endo Black Incorporated is an organization that focuses on advocating for African American women and women of color affected by endometriosis. This was a platform that started in 2015 as just an Instagram page. It grew in 2019 to doing fellowshipping with each other, in-person events. We were able to get incorporations, 501c3, trademarking. And so we are official as of 2022, which is wonderful because our conference is coming up literally on Saturday. So we are an organization that really just focuses on making sure that we are connecting people and also providing education and advocacy. We have a platform, we have a Pinterest, a YouTube, a LinkedIn, an Instagram, a Twitter, a Facebook. We had a Clubhouse, but I'm not doing that. That's a lot of time. But we want to make sure that we are changing the narrative and making sure that we are connecting women with doctors that are listening to them. Also, making sure we're changing the narrative so people understand that it's not rare for African American women to have endometriosis. In 2020, there were 4 hospitals that are very important and significant hospitals that actually had on their website that a risk factor of endometriosis was to be a white woman. And that could be very detrimental to the community because if you go to that doctor's office or if you go to the website and you're trying to get answers about what's happening with your body and that's the first thing you read, you're also just ready to write that off. So it's very imperative that we have factual information out there that will be able to get a proper diagnosis. We also are focusing on making sure that we're just providing opportunities in the community to have constant conversations, something similar to what we're doing today, because the more we talk about it, the more we're going to bridge that gap, the more we're going to raise awareness, the more we're going to get answers. So those are some of the things that we do. We want to make sure that we're not just talking to people in the endo community, sometimes we want to make sure that we're also connecting to other organizations. As I spoke about before, we know for a fact that if endometriosis affected more men, that there would be answers. So we are connecting with those men. We are connecting with people that are in organizations that have nothing to do with endometriosis, but have something to do with how we're affected. So that could be mental illness, that could be infertility organizations, that could be foster care organizations, that could be organizations that provide non-toxic chemical sanitary napkins and things of that nature. So those are things that we're doing. We're building those relationships, we're collaborating in the community, and we're making sure that we're trying to build more advocacy opportunities and education in the community. So I hope I gave a really decent overview of what we're doing in the community. And thank you.
That's perfect. Thank you so much. And I do have some questions from the registration forms that were submitted. Let me see. The first one is, what changes are happening? What is the positives that we see from endometriosis?
I would
for me,
say,
no,
you go ahead.
I would just say that as a positive is that not necessarily, the positive is that you see it more, right? We now know that celebrities are spokespersons for different organizations, and they're sharing their stories. Like Amy Schumer, the comedian, she has a show where in her show, her character has endometriosis. So, I feel like it's becoming more into the forefront. I feel like I'm hearing the conversations more. I don't know if it's just because I'm in them and I'm aware, but even I have friends who will reach out to me and say, oh, hey, I heard such and such has endometriosis. And I'm like, oh yeah, I knew that, thanks. So I'm seeing where others are even becoming more aware. So I'm hopeful that, unfortunately we're having to use big names to bring light on it, but if that's what it takes, then that's what it takes.
For me, I would say just connecting with people. I love it. Endometriosis has allowed me to connect with women in London, Australia, places that I probably would not be connecting with people had it not been for endometriosis. So just being able to form my endo tribe and connect with people and meet people, and now I have places to travel to. So that's really, I love traveling. If endo is going to allow me to travel, hey, I'm hopping on a plane immediately. So those are some of the good things. And that's it for me, though. That's the only that's the only good thing.
I would say basically the same thing, connecting the sisterhood, um, it's so many of us that experience endometriosis, and you're never aware until you open your mouth and say something, and you hear, like stories and things of that nature. So that one thing, the awareness, putting it out there. I started doing research, and I'm like, okay, this community is bigger than me. It's not a community of one. So that definitely I feel is on the rise, and just connecting each other, so that maybe there's something that you can share with me or I can share with you that can kind of help you through your journey. Something that I've tried that maybe, try this, before you move forward with that surgery, try this, do this. So I think that just building that awareness that, you're not experiencing this by yourself. There are so many, other women that have gone through it, that is going through it with you. So basically bringing about that awareness, I believe is, definitely a plus factor. And so I say to anyone that, is experiencing, don't be afraid to, share your story, as, I was pushed to do.
You're right about that. After I created a video just on my own to talk about endometriosis, and I made it and I held on to it. I didn't release it for a very long time because I was so, not even ashamed, but just more scared, I guess, of the reaction that I would get. It's a stigma. Oh, you have an illness. Ooh, what is it? I've even had people, is that an STD? But but to piggyback off of what you guys both just said, the community, after I shared my story, the amount of people who I know who've reached out to me and said, thank you for sharing your story, or I have endometriosis, I thought I was alone. What did you do for this, this, and this? So yes, y'all are both right, as well as that, having the community and knowing that, your story is making a difference, or you're making an impact, or you're helping others, or they're helping you. Just knowing that that you're not alone is one of the biggest things, biggest takeaways of this disease that I've had to learn, because you feel so alone sometimes.
I completely agree with you, ladies. Definitely the connection. Being on so many platforms, sharing my story has definitely helped me and healed me, because it took me a long time to talk about my journey. Even after writing my book, it was still tough to talk about my journey after that. Because people wanted to promote your book, and it's like, I'm not ready to tell my story just yet. Just read the book. But being on so many platforms has definitely helped to continue to spread the awareness of endometriosis. And I think they have so many treatment plans now. It's not just, oh, you have to take hormonal meds, but they have so many treatment options now for people to go to. And then also the associations that people can run to now as well. So it's been some positives coming from endometriosis. So thank you all, ladies. And let's see the next question. The next question, I think, is going back to infertility or pregnancy. What are the odds of pregnancy and dealing with endometriosis, and how can those odds be improved?
I don't know of the odds, and so I'm not going to speak on it. I don't know what the odds are. I don't know how it can be improved. I guess it just goes back to research and understanding this disease. But like I said earlier, I don't know, because I had that taken from me.
I can't really speak to the true odds, but I definitely would say would definitely depend on when your endometriosis was found. Mine found at stage 4. At that point, I knew that bearing children was not an option. So I would probably say, depending on the level and when your endometriosis diagnosis is made.
I would honestly just say I don't know. I think it really depends on the person. Honestly, there are a lot of women that I have connected with over the years that are pregnant right now. Like, there is somebody I know specifically who's already had a child. She came to my event in 2019, told her story. She actually has 2 uteruses, but that's a whole nother situation. She has endometriosis and she's currently pregnant right now. So I think it's imperative to do your research. Definitely get those levels checked to see what the options are for you. Start talking to your OBGYN about it like tomorrow. And really just look into the community. We held a mommy and endometriosis this panel discussion last year for our conference, and every single one of them, we had 6 women on the panel, and every single one of them, they conceived a natural childbirth. So there's options. It may not be options for everybody. Everybody may not have the opportunity to have children. But I think that just because you have endometriosis, you don't want to cancel yourself out until you try and get those answers. A lot of people just automatically say, oh, I have endometriosis, I don't have a shot. Don't do that to yourself, because I think you're closing the door before you even get a chance to see what the opportunities are.
I completely agree. I think a lot of women are having children living with endometriosis, and I think it just depends on the severity of endometriosis that your risk become higher of infertility. So it's definitely best to just speak with your healthcare providers on that information. So.
And I just want to share one more thing. We have several volunteers, and within probably 6 months 10 of them all got pregnant. I don't know if it was like the pregnancy pack or what happened. Maybe it was something, or it could have just been the pandemic. I don't know what it was, but back to my each month, I was like, oh, you're taking maternity leave. Oh, you're not going to be able to volunteer. Oh, you're going to be off. So it's just like, you want to make sure that you are really, really just trying to figure it out. Definitely talk to your OBGYN, but there is a possibility. Just check it out.
Thank you, ladies. And I have one more question. How can you be supported on your journey with living with endometriosis, or are you supported on your journey?
I guess the support would come by us speaking up and being willing to share that, I'm experiencing this and I'm experiencing that, and this is why, I'm moving a little slower today, or it's taking me a little bit longer to get ready because, this is what I experience on a daily basis. So it starts with us to be able to gain that support, because if nobody knows what's going on with us, they'll just assume that, one thing or another. So basically starting with being open and honest and sharing with your family and those that are, nearest to you, that you're sharing that information with you, that this is something that you do experience on a regular basis. And it does affect your everyday lives. It's not just in your head.
I would definitely piggyback what you just said, Nicole. Talking to people about it. My mom, I was very lucky. My mom, she passed away last year, but she was with me every step of my journey, came to every test, came to every procedure, every surgery, took care of me, and was just there for me 100%. My family the same way. I was very, like I'm saying, I'm very lucky because not everybody gets this, and also got my friends on board, but it was because of sharing my story and talking and even showing them like, okay, this is me on a very bad day, and these bad days can last for a long time, like showing them. And I mean, even to this day, my friends are very supportive. But just the other week, I was on vacation with one of my girlfriends, and she said, "Well, aren't you cured? You've had the hysterectomy." And I said, "No, there is no cure. Like, I still have some issues. Sometimes I still have like the PMS symptoms, that you would get before your period. So I do get that stuff, but finding good support groups, online groups, Facebook groups, Instagram groups, like Lauren's organization, Endometriosis Association. But, I got lucky. Both my parents were right there every single step, and they both passed away last year. So now I'm kind of, on this journey. I feel like a little bit more alone, but I know that they're still with me in spirit.
For me in general, I think the best way to support is to communicate with that person you're trying to support. If you have someone that is close to you that has endometriosis, ask them what is the best way, because we're all different. That may look like fixing a cup of tea, or purchasing a weighted blanket, or visiting the doctor's office with them. It may look like donating to their favorite or their organization that they go to or they support. It just really depends. Overall, how do you support the endometriosis community is that you advocate. You can call legislators, you can lobby, you can make sure that young girls are getting non-toxic chemical sanitary napkins. You can make sure that we're making sure that we're providing these non-toxic chemicals in the school system. There's so many different things that you can do. You just have to make sure that you're doing your research, do your due diligence, she kind of hit it on the head, but you want to make sure you're reading books. The research it's really in the books. And I was getting ready to pull out a whole bunch of books, but I'm going to refrain from doing that. But just reading up. There's so many books on women with endometriosis, medical professionals, health equity, all of those things that you can really do research on your own before you even speak to somebody with endometriosis. And sometimes support looks like sitting with someone and being quiet. So you really just have to understand that person and be mindful that sometimes they don't want to talk, that it could be triggering for them, that they don't want to relive their experience over and over and over and over again. So just be mindful of that, knowing that there are different ways to support different people. So
that is so true. Thank you, ladies. And for me, I think the support just begins with listening. As Ms. Lauren said, listening, having that support group. I have my family, my husband, my kids. Thank God for my mom, my sisters who are in the healthcare field, because woo, they gave me a lot of information. They knew a lot before I even knew. I remember the time that I had my surgery. I had to have surgery of a patient that has colon cancer. It was 6 hours, 5.5 hours, excruciating pain afterwards. And they knew from that surgery that I was going to have a ileostomy bag put on. And I was devastated when I found out I had to put that in. But they knew as soon as I came out of that surgery that something was going to be wrong because how extensive my surgery was. So thank God for my mom, my sisters, my husband, my children. They were very supportive and very patient with me and understood the process, even when I didn't understand it myself. So even though I say I was alone in my pain, that's just from my pain itself, because a lot of information I didn't share because I was too embarrassed to share what symptoms I was having and the depth of my pain. Because imagine feces coming from not even get too graphic, from your vagina at the same time. Is just, it was just a horrible experience, and I wouldn't wish that on my worst enemies. So I'm very grateful for my family and the few friends that I do have. So very grateful for them. So do we have any other questions in the chat? I don't think we do. But do you ladies have anything to add?
I'm just going to add before we move forward, I want to thank God for my mom too. When I found out that I had endometriosis, I was living in Atlanta and she was here in Texas. And she came to take care of me on a couple of occasions and finally said, baby girl, you're going to have to either make a decision. You're going to have to have the surgery there or you're going to have to come home. So I came home. And, definitely, like Lauren, I don't know what I would do without my mom. Lindsay, I'm sorry. I don't know what I would do without my mom. So definitely, my mom has definitely been a big support, as I've gone through this journey. And she's watching. Thanks, Mom.
Hi, Ms. Foster. Okay, do you ladies have anything else to add before we begin to close? Is there any questions before we move on?
I just wanted to say thank you for having me, for having us. This has been an amazing talk. I hope that people are able to get some idea of what endometriosis is, how to manage it, how to support people. So thank you so much for providing this platform and allowing us to share our personal experiences with everybody.
Thank you. I appreciate you, ladies.
Absolutely. I second that. And I hope that from everyone who watched, listened, or learned, all of our stories are different, but we still suffer the same. So it's nice to be able to be in our community right now and talking to folks about our journeys and getting the education and awareness out there. So thank you.